What's up, my people? Welcome back to my channel. Thank you so much for the love that you're showing me. So today we're going to take a break from the pregnancy series because I have a special guest and we're going to talk about adverse drug reactions. Most people usually say they are side effects, but anyway, you'll see the difference as we go by. So I have Dr. Samuel Were. Daktari, welcome. You can introduce yourself.
Thank you very much, Linda. Hello, viewers. My name is Dr. Samuel Were, a supply chain pharmacist, and I'm happy and enthusiastic to be part of this forum today.
Okay. So as I've said earlier, we are going to talk about adverse drug reactions. So Daktari can just take us through what that is. I know many of you are looking at me like, what is that? You're talking in jargons, but yeah, let's dive into that.
Okay, adverse drug reactions normally come up when a patient takes a drug either meant for treatment or for diagnosis, and there are those effects that normally come that are noxious arising from taking of the medication. There is normally a relationship between the drug and the effects.
Yeah, so basically what adverse drug reaction is, this is just a reaction that someone has when they take a medicine. So for example, you take something like Piriton, let me say, because that is the common thing that you take, and then maybe you fall asleep or maybe you feel drowsy, something of the sort. So that is what we are going to address today. And as Dr. Ria said, it comes about when someone takes a drug normally used for, maybe you're sick and then they give you a drug. Yeah, so Dr. Ria, we can go to what really causes adverse drug reactions.
Before you progress, just remember that adverse drug reactions can either happen immediately or it might be delayed.
Yeah.
So in this case, the patient has to know that in some cases the reaction will happen immediately after taking the drug, but in some cases it might be what we call the delayed onset.
Yes.
Yeah.
So basically they're just like different types of adverse drug reactions, but these ones I won't take you through because it's a bit technical. It only belongs to now my pharmacists and my doctors. So for you, what you just have to know is, let us look at the difference between an adverse effect and a side effect, because I know many people usually say like this is a side effect, yet it might turn out to be an adverse effect. So where do we draw the line between now a side effect and an adverse drug reaction?
Linda, the side effect basically is that response that one gets after taking a drug. Basically, it's normally related on how the drug functions in the body, and the side effect can be beneficial or not. Just to give an example, a side effect might be, for example, when you take Piriton, you find that you feel sleepy or drowsy. That's more of a side effect that is arising from the mode of action of the drug.
Yeah. So most times you can see that an adverse drug reaction, it's unwanted and it's not really beneficial at the end of the day. This means that, for example, the way he has said someone is on Piriton, so maybe you have very bad cough, very dry allergic cough, and then they give you Piriton, and then the cough is interfering with your sleep. So when they give you Piriton, you'll be able to sleep. So you see, it's a side effect and that is good. But if at all it's causing now drowsiness or dizziness, and then you cannot even operate your machine, then that is when we look at it as an adverse drug reaction.
Yeah, basically.
Yeah. So let us look at the causes. What really causes like people to experience adverse drug reactions?
Basically, there is a marriage of issues, marriage of factors that can cause one to have adverse drug reactions. One, it can be hereditary, basically running through the family.
Yeah.
In this case, for example, you find some lineage of people in a family, they are hypersensitive to certain types of drugs.
Medicines, yes.
For example, some families, you find that when they take a drug that has sulfur, they tend to react and they tend to react badly.
Yeah.
So that's something that might run through the family.
So another cause, it could be like it's because of your, first of all he said now genetics, then the second one, it could be because you're taking a lot of medication. So for example, you have like a heart condition, maybe you have a kidney condition, and then they give you drugs. So those drugs can interact in such a way that they interact with each other and cause adverse drug reactions.
Yeah, basically also you can think of alcohol in the same way. A doctor gives you the medication and you continue also taking alcohol. Case scenario, metronidazole or flagyl, and you take alcohol along with it.
Yeah, so that is why I always tell you guys, wachaneni na pombe mkikuwa kwa madawa, it really doesn't help. Yeah, then we can look also at another cause. You can look at now the people who are
Basically
old.
age,
Yes,
comes
age.
in handy.
Yeah. So
You find that the old people, of course, their organs are a little bit, the functionality of their organs is a little bit compromised. You find that now when they take the drugs at normal doses, basically you find that now we have these reactions happening, because now the metabolism or the breakdown of the drugs is not as was expected. Same to that in the aspect of age, you also have the young ones, basically infants. For the infants, they tend to react also differently because of undeveloped organs. They tend also to react differently to these medications.
Okay. Yeah, so those are some of the causes, unless I've left out any.
Basically, in addition, you can also think of underlying conditions, diseases.
Condition, yeah.
In this case, you find that if someone has a kidney disease, a liver disease, of course it might also affect the way they respond to this medication.
And that is very, very important for the medics who are watching me, for the pharmacists, for the nurses, for anyone in the healthcare professional. When you're actually giving a patient a medicine, it's important that you look at their parameters, their weight, their height, you look at their body mass index, you look at their kidney function, their body function, their liver function, because these are some of the factors that can predispose someone to getting adverse drug reactions. Yeah, so now we can look at, we've looked at now the causes, and also some of the causes could be also be relating to the drug. The way in which the drug is actually made, it can predispose someone to having adverse drug reactions.
You're right.
Then so finally now we look at how do you report adverse drug reactions, and is it really important to report adverse drug reactions?
From the patient safety aspect of it, it's really important to report. And here we normally say that you need not to be very sure whether it's a side effect, whether it's an adverse drug reaction. Basically, when you suspect anything that is not normal, basically you just have to report. And it usually comes about, because we had earlier on we had talked about now types of adverse drug reactions. There are some that come immediately and some come later on in life. We can take, for example, like anti-cancer drugs. Those drugs usually cause effects way later in life. So it's really important when you've been on anti-cancer drugs, you can go and report. So how do we report it? As a patient, you're supposed to report to the healthcare provider. So maybe you came to the chemist and then they dispensed you medicines. And then you develop a reaction and you're suspecting it might not really be the adverse drug reaction, but when you're on drugs and then you develop an issue, it's important to go back to the healthcare professional, go back to that pharmacy, go back to that medic, go back to that hospital and report like, hey, I'm on these drugs and this is what I'm experiencing. It could be a headache, it could be anything like a stomach issue, it could be a skin reaction. It's important that you report that. So and just to delve in, when you're reporting, you have to make sure that you know which particular drug are you taking. What are the details? Probably if you have a package of that drug, you can carry it along and show it to the health practitioner. You can also describe how you are feeling, what are the effects are you feeling, and preferably if you can take that all those details on how you have been taking and any other medication you have been taking alongside, you have to carry them all.
So, as that has been said, I was just going through the Pharmacy and Poisons Board. If you don't know, this is like the body that is responsible for the practice of pharmacy and registering medicines across all the country. So they've come up with tools. I think as I'm looking for them, you can share now the yellow form and the pink form. Then you can just project for people to see that.
Basically, in reporting, we have various forms that help, especially for health practitioners, pharmacists, to try and report issues that come up in relation to adverse drug reaction. One, we have the pink form. This form is basically used to report medicines that are of poor quality.
I don't know. I think you can focus on this so that people can actually see. So you can see it's pink in color and it's used to report poor quality medication. So
here if you find medicines that you are trying to take and your situation or your disease is not changing, you find the packaging is a bit poor, you find the medicine is developing some mold, and you feel that the medicine is of poor quality, basically this is a kind of a form that can be used to notify the PPB, which is the regulator.
And this also on poor quality medication, you could go to a pharmacy and then you're given a drug that has expired, or you could go, maybe the packs that are usually there, maybe it's not packaged well, maybe you're suspecting it's counterfeit. Please go and report. And that's why I always tell you, make sure you screen through the medicines that you're being given, because in this era they're counterfeits. In this era, I'm sorry to say, they're duplicates of the drugs that you're taking. You can find out that someone is on one drug, but their blood pressure, maybe it's not even improving. Like they're on one constant drug, they're like being added drugs. It could be then the doctor is telling you you're not taking your medicines. The problem could be the medicine. So if you're in such a situation, make sure you go back to where you bought and report that medicine, because it could be counterfeit. So you can take us through now the other forms.
Basically, to just add on what Linda have said, you need not to be very sure about it. As long as you suspect, you can just report or find a medical practitioner to guide you through. Another form here, we have the yellow form. The yellow form is a form meant to report the adverse drug reactions. You have taken a certain medicine and you are developing some reactions to it, some effects that you feel are not normal, the responses that are not normal. Basically, that's the kind of form where the health practitioners normally use to report to the regulator.
My healthcare professionals, for the medics and anyone in the healthcare field, I know like pharmacists are the ones who usually like actually capture most of these ADRs. So I want to encourage most of the other healthcare professionals, nurses, you deal with patients most of the time. Please take note of this. So this is, Daktari is going to tell us, like, as a healthcare professional, what are you going to do when you're actually taking down the information to fill in the yellow form. So he can just tell us more about that.
Basically you have to have the bare minimums in reporting a case about an ADR. Basically, you have to ensure that you have the identifiable patient. For identifiable patient, you have to pick the biodata basically, but remember to use initials for the sake of maintaining
privacy of the
patient. You also have to ensure that there is an identifiable drug. In this case, which drug was causing these effects. You have to capture all the details, the lot number, the brand name, which drug was it. You also have to give a brief description about the kind of the ADR that was, what were the symptoms, what were the effects or the responses the patient was experiencing, and also you can also note what were some of the actions that were taken following the reactions or the responses.
So I hope this video has really educated you, and thank you Daktari for coming and honoring my promise to just shed more light on adverse drug reactions. So if you have any question on any like type of side effect on any drug that you're on, please leave it down in the comment section. If you have any questions also, leave down in the comment section. We'll be able to interact. So thank you so much, and I'll see you on my next video. Bye.